Hi, I'm Dr. Juan. Today we're going to solve a mystery. Why does a new tooth sometimes not appear when it should? It's common to look in the mirror hoping to see that tooth and nothing. This can be worrying, but it usually has an explanation and a solution. Imagine each tooth is a seed under the gum. To sprout, it needs space and a clear path. Sometimes another tooth takes its place, or the bone is too hard. It's not that the tooth doesn't want to come out, but that something is stopping it. Patience is key. Everybody has its own pace, and teeth can be delayed without it being a cause for alarm. If a lot of time passes or the opposite tooth came out months ago, it's time to investigate, but without panic. Underneath each baby tooth is a permanent tooth waiting for its turn, like an actor backstage. When the baby tooth falls out, the permanent one should come in, but sometimes it gets stuck and can't find its way out. Our goal is to help all teeth have their moment to shine. Understanding why a tooth stays hidden is the first step to solving it. So, relax. Most of the time, you just have to wait or see the dentist. Now, let's look at the most common causes of this mystery. Let's look for clues. Genetics is a common cause. If teeth are slow to come in or some are missing in your family, it can happen to you. Another cause is lack of space. If the jaw is small, the teeth don't fit, and one can get stuck under the gum. Sometimes the tooth grows in the wrong direction and bumps into another, becoming impacted. This is common with wisdom teeth and upper canines. In rare cases, the tooth simply doesn't exist, which we call dental agenesis. It's genetic and has a solution. The important thing is to identify the cause to choose the best treatment. Modern dentistry offers solutions like implants or bridges for missing teeth. Consulting a professional is key to planning the best path. Now let's dive deeper into the topic of space. The mouth is like a city. Each tooth needs its own plot of land. If the jaw doesn't grow enough, the teeth get crowded. Permanent teeth are bigger than baby teeth, and sometimes there isn't enough space. If a baby tooth is lost too early, the neighbors move into its spot, and the permanent tooth can't come out. That's why it's vital to take care of baby teeth. They are the guardians of space. Habits like thumb sucking, using a pacifier for too long, or breathing through the mouth can affect jaw development. These habits can narrow the palate and reduce space for the teeth. Dentists ask about these habits because they help understand and correct problems early. If you notice a tooth not coming in, and there was early loss of baby teeth, see the dentist. Space is key for an organized smile. Now let's talk about impacted teeth. An impacted tooth is one that can't come out because something is blocking it. Another tooth, dense bone, or thick gum. Wisdom teeth and upper canines are the champions of getting stuck. If the tooth is well positioned but without space, orthodontics can help by moving other teeth. Sometimes a small surgery is needed to free the tooth and guide it with orthodontics. Detecting and treating an impacted tooth is important, otherwise it can damage neighboring teeth or cause infections. Panoramic X-rays allow us to see hidden teeth and anticipate problems. It's recommended to have them done around 7 or 8 years old. This way, we can act before the problem gets complicated. Early detection is key for a healthy smile. When is it time to visit the dentist? Let's see. When to consult. If you notice asymmetry, for example, one tooth came out and its pair didn't, it's time to go to the dentist. The first visit to the orthodontist is recommended at 7 years old when space and bite can already be evaluated. A panoramic X-ray helps to see old developing teeth and detect obstacles. Braces are not always needed immediately, but planning and prevention are. Current dental technology allows for comfortable and effective diagnoses and treatments. Don't be afraid, the dentist is your ally for a healthy smile. When in doubt, consult. It's better to be safe than sorry. Keep learning about oral health and take care of your smile. Until next time, if you like this video, subscribe, share, and leave us your comments. Your smile is our inspiration.